go ahead and start. If you can start the recording. Thank you very much. Welcome, everyone. I'm Holly Morehouse from Vermont After School. We have the whole Vermont After School team here in force. If the team can just wave so you can see where everybody is. Couple of logistics for the call today. Please make sure that your microphone is muted. Also, please know that if anything weird happens and we have to close down the Zoom session quickly for any reason, that we'll be back in touch via email with follow-up. So just know that. The flow for today, we're going to have Dr. Brina Holmes as our guest today to speak on the health and safety guidance as we look forward to summer. She's going to do a presentation for about 15 minutes, and then we're going to save the bulk of time for questions. We do have and appreciate all of your questions that you submitted ahead of time. We've been through them, we have organized them, so Brina and I are going to kind of work through that set. We're also going to keep it open in the chat so that as additional questions come to mind, we have folks from the team monitoring the chat that you can enter your questions there as well. And then at the very end, we're going to save 5 minutes or so at the end to talk about a whole host of other resources and ways to continue this discussion and funding opportunities and so forth to support your work over the next few weeks and into the summer. I do want to start with a little bit of thinking about frames and the time that we're in. I feel like many of you, us at Vermont After School, we're anxious to see young people again, to be working with children and youth, to have programs running, and to really do all that amazing stuff that all of you do around social emotional learning and connectedness and youth well-being and self-efficacy and all that learning and growth that happens in the programs that you run and that are so essential to the healthy development and growth of young people. We also, like you, recognize that this is a time of stress and fear and uncertainty, and want to acknowledge that we need to build this picture of what Vermont looks like this summer for our children and youth together. So Brina is going to share all the health and safety guidance as we know it today. It is not going to have every single answer yet. There will be things that you will bring up. There will be things that we discover together as we work through preparations and opening, and we will need to hear from you and work together to figure out how we do this and how we do this well. None of us have worked through or been through these scenarios or anything like it before in our lives. So I want to encourage you to not just plug into this webinar. I want you to take it, encourage you to take advantage of some of the other conversations that we have ongoing, to be in touch with us, to let us know what you're thinking, what you're encountering, what obstacles you're running into, what solutions you're finding. That's another huge part of this field, is how do we share solutions and approaches with each other. So really keep that frame in mind. And then the other frame that I know Brina will speak to as well, that we really want to put out there, is that this idea of reopening programs and being ready for summer sometimes gets tangled into this very economic argument. And I have been guilty of this myself. And I know that it is true that working families cannot work if their children are not safe and cared for. And we hear that every day. But ultimately, the reason that you do the work you do and that your programs exist is for that healthy child and youth development, right? It's for the 4-year-olds playing together. It's for the 7 and 8-year-olds, working on projects. It's for the middle school and high schoolers, building robots and challenging themselves in new and different ways. So, that's the reason we exist, and that's the reason that we're trying to figure out how can we serve the young people in Vermont once again. So please keep those frames in mind. Really, why do we do this work, and also that problem-solving frame as we move through the session. So without any more framing, I am going to hand it over to Dr. Brina Holmes, who is the Director of Maternal and Child Health Division at the Department of Health here in Vermont and has been really leading on working with us and with childcare programs and summer camp programs on how to serve children and youth. So I will turn it over to you, Brina.
Hi, everyone. I'm so happy to be here. I really wish well, I guess we did record what Holly just said, because it's a super important time for us to acknowledge our concerns, but also live in a solution-based space and strength-based space like you all do beautifully. I feel so good today to be with you. I'm actually an adolescent pediatrician by training, and my practice in Middlebury for 12 years was primarily adolescents. So my policy job has taken me into lots of age groups, including a ton of work in early childhood, but I'm happy today to be with my people. So I did also want to acknowledge that many of you stepped right up in March and said, what do we need to do to get some emergency care in place for the essential workers kids? And I will always hold you among the heroes of this terrible year and this difficult year. As we reopen, I think a lot of the principles stand on how we did that in March with your help. And then there are a few small tweaks. So the way we want to do today is put out some information together. I hope I only have 6 slides. When I say 6, I usually have 9. And then spend lots of time on these questions that have come in and this is really going to be a detailed oriented, nitty gritty, how do you really do this? I promise to not stay high level. The guidance, which we call childcare summer and after school, is out today. Great timing. We're waiting for the live link for you to see it, because if you send a PDF, it changes a lot. And if the CDC shifts something, or if the data tells us we have to do something different, we have to go in and change it. And if people have old PDFs floating around, it's problematic. So the link will be coming. Holly can send it out the minute I get it live on my website. It can go to your website. It will go to Child Development Division's website. And then, but I'm going to try to hit some high points today. And I'm going to go like this to advance. I have so much gratitude for you. And I continue to marvel at your ability to figure out how to do this. It's not remotely easy to put facial coverings on young people, to think about distancing, which we now call physical distancing. The language matters a lot, so we're not saying social distancing anymore. Correct me if I misspeak. And it's also very hard to work with people whose parents are anxious, whose the kids themselves are experiencing some uncertainty, and you all, as I imagine, carry it as well. So we have to check ourselves and then be available to the young people we all care about so deeply. I always like to call out this Department of Health website because we change it all the time and we love it. It came out funny today because I have some technical skill issues, but it does get updated every day at 1 o'clock. It has the case-by-case, county by county, real life epidemiologic curves on what's going on in Vermont, and we are in great shape today. Let's just take a moment to talk about that, because for the last 2 days, we've had no new cases in the state, despite the fact that we're undergoing a big testing push from our governor. He wants tons and tons and tons of people tested, including people with no symptoms. And as early as last week, we put out some information that maybe those of you that have been caring for kids during the emergency, March and April, should go out and get tested. We still say that, but as of today, they just said, oh no, forget it. Everybody should go out. If anybody that's not having symptoms can go get a test if they want it. So just to you all, because I like to ground this in science, that this won't really do much for case by case, making people feel safer that a potential childcare person or a youth worker is negative today, because you could easily acquire the virus and be positive tomorrow. But it is a nice way to do epidemiology, to pull out anyone in our world currently who's positive for the virus, even without symptoms. And then those folks go home and isolate for a bit, including their close contacts. So we continue to have the restarting and more people out and about. So I'm happy to talk to you more about epidemiology sometime, but check the website. You've heard me say this before. If those of you that are new to me, One of the things I like most about myself is I can admit when I'm wrong. Sometimes I have to call a group back the very next day and say, I told you a bunch of stuff yesterday that was incorrect or that changed. So stick with me as I do the best I can to get information to you. So as I told you, coming this week is actually coming today. And it was 9 pages, it's now 13. Apologies in advance. We are working together tomorrow with our communications office and the child development division to put together kind of different layers of materials for families, for programs, to pull out some of the more forward or outward facing guidance that we want everyone to know, not just the people running or working in the programs. So I know that the length of this is cumbersome, and I want it to be comprehensive without being overwhelming. So that many of you have done this, but I thought it was worth reminding folks that one of the essential features of opening anything is to have a health screening at the door. And that involves a daily health check where you ask children themselves if they're old enough, but it's better to ask their caregivers, has the child been in contact with anyone with the virus, or have they themselves felt unwell? And we've expanded this orange part. I hope you followed the CDC that it used to be cough, fever, shortness of breath, very specific. It's turning out that folks with COVID have tons of other symptoms. Some have chills only, some have just all over muscle ache, pain, can't get out of bed, headache, sore throat, and that not being able to taste or smell is real. And it's super interesting, and they have no idea why. So the health screening requires a lot of good setup, which many of you have already done so beautifully. I did want to call out school nurses. I know some of your programs have access to school nurses, which is my favorite model because school nurses are part of my long career engagement in an essential part of our health system. So you do have to, wash your hands. The cloth facial masks I'll address in a second, but I know you're aware because we're wearing them as just general citizens. Eye protection just means a pair of glasses. And if you don't wear glasses, you can just buy a, $5 pair of cheapies or wear a pair of, non-lens, without any prescription, just the fashion piece of plastic. And it's only because the mucous membrane of our eye has a small potential to receive the viral particles. And then disposable gloves for each kid as you check his or her temperature. So the cloth facial covering story is one of the most interesting. I like the way our health commissioner talks about this. This is a behavior change that's here for a while. And I don't like to prognosticate or try to tell you for how long, but let's get everybody a couple of these face coverings, and let's try to make this just a general principle of the way we function. So it's not a mask, and that's important to me because we need that terminology to be for healthcare providers. And it really is a different approach when you have cloth on your face. It's softer, easier, and then it's actually much easier to reuse. So the CDC has nice guidance about it. I'd love to talk to Holly in the future, or all of you, about supply chains for the facial coverings, because there are so many great community folks that want to help, that are making them for each other, for themselves. Our neighbor brought some down to us because my husband's a healthcare provider as well. We have all these just anecdotes, and I feel this is a Holly role, but I feel the need to put it in a grid and have every community have a couple of people that are willing to make cloth facial coverings for the great workforce that's out working with our kids. And then just a word about kids. So this, I would say, has generated the most questions since we announced the emergency guidance back in March. This is a recommendation. It's not a requirement. Almost everything in the guidance is a recommendation. There are a few things that we call out as a must, but this is the notion that kids know that there's something going on in this world, even the younger kids, and it's not really reasonable for their development that we say to them, you're different than us, we have to do this thing, but you don't. I know that kids will struggle developmentally with this, and I know that there are certain health conditions around sensory integration challenges, or even kids with some breathing difficulties, that this is never going to happen. But in the general scheme of your work, I'd like you to try, and I'd like you to do it by, this is such a great group to talk to about this. the young people know it's a pandemic and they want to prevent the spread of germs and they want to be a part of it. There's no exclusion principle here. So um, the only thing the CDC tells us is don't use them under 2. So this is we're building this as we fly. The American Academy of Pediatrics has some resource about it. It's not my favorite, but there are some ideas on what language to use around germ prevention. There's this whole contortion that goes on that's best for a COVID time, and that involves not allowing everybody to come at the same time. I really don't know how to operationalize this except to just try, but I did want you to think about it in the context of your own programs. You know, even if it's just the way you've noticed that when you go to pick up a pizza, you know, people wait in the car, one person gets his pizza, then the next gal comes in. This is interesting to me as well because I'm familiar with the notion that there's an early morning person sometimes in a program that does a multi-age group, and then maybe a different person that stays for that last hour. And in this time, we can't do that. And the reason is the most essential public health approach here is to get a pod of people together and keep them together all day with no cross-pollination. I'm mixing metaphor, you know, I'm giving you like the pod of whales plus the pollination of the flower. But so help me understand how this is going to work and where we can help you. It's not on a slide because it's late breaking news, but we got the go ahead to put in the guidance that the group is 25 kids starting in June. Let me correct that. It's 25 individuals starting in June. So that's the pod, not 10. And what is exciting to me, just from a social emotional place, is that if the data stays good, 25 is going to be the society recommendation as well for group group dynamics. So it isn't going to be something separate for the care of children. Like you guys get in a room with 25, the rest of us are going to be with 10. So stay tuned on that. And that, we're advocating really well with getting the data into the right policymakers to make sure that this is, that it makes sense for you operationally and also is safe. So there's a lot here nuanced about could just the same person drop off? I sure would love that. It's just, please know, I know some families can't function this way based on the way they work and the shifts and who may or may not have that capacity. And I feel that, this is just guidance. Same with elderly folks. And I guess the one thing I'd say strongly is if someone's self-quarantining, and the language matters here, self-quarantining people aren't sick, but they're waiting to see if they get sick in a incubation period of the virus, which is about 14 days. Those folks shouldn't be doing the drop-off pickup. Really quick, there's a few things that transcend us, which is the VOSHA, the Vermont Occupational Safety Health Administration. I don't even know what it stands for, VOSHA, but they have a training you're all going to have to look at. It's just PowerPoint. It's not like a training where you sit and there's someone talking to you. It's just looking through some slides, very similar to what we produce, but a little higher level for all businesses and public facing activities starting now. And you do have to have a sign. We have made better signs than this from the Let's Grow Kids group, and they are going to distribute them to any or all. There's just going to be a link and you can just print, and I have a fantasy about laminating them, but we'll see. So there's required signage, which is not your responsibility. We will get them to you. This is the slide I should have updated to say we're at 25 kids in June. That's not true. 25 people. Help me to not botch that. That's a botch. And then that means you stay together. Nobody can take 25 and then put another 25. I know this is obvious. And then the hand washing, we're getting a lot of feedback from, people are doing a lot of random calling of the health department, reporting things like people aren't washing their hands for 20 seconds. It's really more like 10, which I know to be true. It's, the happy birthday song twice. It's a long time. So just see if you can model that. And then you really can't have outside visitors, but we are clearing the way for the services that we provide to young people, especially the littlest, in the context of care, like OT, PT, and speech. And that's a little bit of a separate path, but it's coming. Last thing, or second to last, is just to know that supply chains are the biggest topic we get questions about, along with facial covering. And there is, we're trying to get the State Emergency Operations Center to be that chain. We also have Let's Grow Kids and Advocacy Gang helping us, and Holly's in big meetings with us to keep talking about this, and we're never going to ask you to do this without the right supplies. This is the VOSHA training that I mentioned. It's on the Department of Labor's website. It's on every website, easy to find. And then this is the reminder that we're so devoted to this. This is our primary, we have 2 nurses. This is all they're doing in the response, is answering questions from people caring for children about these guidance, really the implementation of the guidance, because it's a comprehensive document, but there's a lot of detail that you need to talk through sometimes with a health professional. So we set it up 8 to 3. We do check Saturday and Sundays once, just to see if there's something that's just really pressing about Monday opening. And I'm really interested in feedback about this, because it works really well, but if you don't get called back, or if it's not working, I need to know. So I think I'm good. That's where I wanted to land.
Great.
If Holly wants to, I've got some of the questions printed out, Holly, but I liked it better the way you framed it, into buckets. So if you want to do that way, I'll take it away.
Yeah. And Brina, can you unshow the screen? Because I love to see all the faces of
Nice.
everybody.
Oh, there you are.
There,
Hi.
everybody. Thank you. So this is now the fun part, right? So what we wanted to do is to get sort of get that baseline, because some of you have been providing care already for children of essential workers and have been, deep into the details, and others have not yet. And so this is maybe your first time thinking about the regs. So we really wanted to find, a baseline that we could all get started. But now I want to get in a little bit of the nitty gritty. And I want to start with questions about ratios, Brina. All right. So you talk about the group size, or the whale pods, of 25, right? So
Yes.
when I'm thinking my program now, does that mean I can only have 25 people total in my entire program? Or does that mean in each room? What do you
So I'm
mean
so glad you asked. So the old guidance said 10 people in a maximum of 50. And this guidance took out the 50. We're saying, like, that doesn't make a lot of sense, because if you're truly holding the integrity of your 25, I don't care how many other people are somewhere in your building, but they're not yours, and you shouldn't be hanging out with them. So there's no limit on that piece now.
Okay.
It's just 25 integral.
But what if I have 25 kindergarten through 3rd graders and 25 4th, 5th, and 6th graders? Can I have 2 groups, but they're very separate throughout the entire day?
But the adults have to stay you can't trade up. That's why I was saying drop-offs not going to work when you leave one person 8 to 9 and one 4 to 5 for all ages. You can't do that. The same, and this is not really about the virus spreading. This is about contact tracing if there is a positive. Because if there is a case, which could happen, most likely it would be in an adult, because kids, we only have 1 kid under the age of 9 in the whole state since March 2nd, 26 kids total. And, there's like 180,000 children under the age of 21 in Vermont. So it's likely, if you do have a positive, it would be an adult. So you want to be able to say, okay, Brina, who were you with? And if Brina's with one group of 25 and then, oh, bummer, in the afternoon she covered another group of 25, now there's 50 kids that need to be contact traced. So we just need to keep it separate. Okay. Every time I just really recognize this, that the staffing logistics are major.
Yeah, so let's say now I've got my 2 groups of 25 and now it's recess, so we go outside and it's a big field. Can we be outside at the same time? What does it look like?
Yeah, outside spaces are great. I love Vermont. Outside spaces are great, but you're going to have to be weird about boundaries and somehow make that part of the gig with the young people, which is like these trees, no one goes beyond these trees. And it's imperfect, but we have to try. One of the other questions I get most is physical distancing with the kids. Do you really just keep yelling 6 feet, 6 feet, 6 feet? And the answer is, yeah, you do. It doesn't mean you're going to be closed down if someone drives by and you're 4 feet apart. It just means keep trying, keep trying. And I know some of you, or many of you, have seen that awesome video from Mount Abe that Mandy made. There are so many strategies in there. I love them, and I think we can keep building on your creativity and just use trees and chalk. And in China they wear these hats so the kids are 6 feet apart. Have you seen the hats with the long pole? Anyway, it's an important part of virus prevention spread, but it's difficult.
Yes. All right. So when I talk about the 25 in my pod, is that 25 per day, or is that like 25 kids assigned to that pod total, but not all of them are coming every day? So some days I might have 17.
Great question. It would be better if there was integrity to the pod, even if some left for a while and came back. So and this is contact tracing, so just forgive me for the public health for a second, but the people that get called after there's a positive case have been in touch with that. They've been within about 5 to 6 hours of close contact up to 2 days before the person had the positive test. And it's completely imperfect science, but it's the best we can figure out from the CDC about there's a chance that 2 days before you got your symptoms, you might have been spreading it a little bit. I mean, it's called asymptomatic spread. It's not significant, but it's not zero. So anyway, so we need groups. Yeah.
Go ahead.
Well, it's just that notion, if you've got kids coming and going, that's imperfect, but we're not going to lock it down.
So what do you do about siblings?
Yeah, go ahead.
Siblings, would you put siblings in the same pod, but what if they're really different ages?
Oh yeah, you don't have to do siblings. Because again, like their exposure is going to be so minimum. It's not really about that. It's about just, I mean, have you heard the commissioner talk about how we should be keeping a log of just where we've been every day? That's all. We just want to be able to come to your program and say, hey, your teacher has COVID. I mean, it's just so tricky, but,
Yeah.
and for the program to say, oh, okay, here's our list of kids. It's called the line list. It's very silly, but, so siblings, whatever you think works best developmentally for kids, put them in the groups they need, but then know that we may come someday and need a list.
So that would be the same, I would think then, because some programs operate in shifts, like they might have a morning program and an afternoon program, but it's probably the same staff. So they may have staff that have a group in the morning and a different group in the afternoon.
Yep.
Probably could keep the staff together, maybe in the same groupings. But then their contract tracing would be more complicated because they essentially might have 50 kids they've been in touch with.
No, we're aware of that nuance. And that goes under the, there's a lot of we're doing the best we can in this. And that's what that goes under. And same with, we've heard, I talked to day camp folks this morning, and I put them in touch with Holly because they need a platform for webinars. And Holly's good at webinars. So they're worried about the kids come in for a week. And that's it. And that's no different. Kids come in a week, great. Then you get the next week, you start over new pods. And we recognize you may have that as well. While I'm talking about it, just one word about out-of-staters. This did not go into my consciousness until recently. Do you folks have like grandparents bring up a kid from Massachusetts that's come and spend a week with you? Yeah, I just figured this out. So those kids have to quarantine. You can't come up and go right to camp on Monday. You can't come Sunday from Massachusetts and go to camp on Monday. I'll just call it camp for the sake of it. So there's a few ways to quarantine, but the easiest is that kid can come up, stay with grandma for 7 days, and then get a test, and then go to care or program, which is a big bummer. I mean, I get it, but you've heard the governor talk about this. I mean, we're doing beautifully, but we're going to have a ton of cases this summer because we move about New England and New York, and folks are going to come up, and we have to have them symptom-free before they go to the grocery store. 14 days. Yeah.
Do you have any concerns about programs that draw young people from different parts of the state?
Mm-mm.
No. Okay.
No. The only hot spots we've had in Vermont, I really don't like that term, but the only areas of sort of concentrated virus have been in long-term care facilities. Every other case has been sporadic, like two. So all your young people they can move about.
Okay. Um, and then just a clarification that seems to be coming through. So they've got 25 bodies in a pod. They're in a room. Do they need a room that is big enough for everybody to be 6 feet apart at all times?
Yeah, again, do the best you can.
Okay.
Not great. That is the recommendation.
Okay. So there's a lot of questions about busing. So
Oh, yeah.
how do we do buses?
Okay, we addressed transportation in the guidance that's coming today. 25 people on a bus or any van or any kind of transportation, same group size. Wash down the seats and the door handle, transport the 25 people, wash it down again.
Okay.
Which is why you need so many supplies.
Okay.
Wash.
Is that the same with like outdoor equipment or any equipment that they're using? So
the guidance says that when a group goes out to an equipment area, after they leave, it needs to be wiped down.
Okay.
And, the CDC is very like, wipe down the sand. I mean, I'm trying to live at this nexus of practicality and science. And so, you do the best you can with the wipe down, but the rungs of a swing, no way, right? Just do the best you can. Because if we're doing the core principles of COVID are about your hands and your face over and over, like over and over and over, wash. So if everybody washes their hands, then goes out to the playground and then goes back, wash their hands, then no one's spreading the virus from the rungs of a swing.
Okay, great. What about, so can like the yoga or pottery instructor come into the program and work is one question. And then the flip is, can programs plan field trips? Like, can they leave the site and go places?
Yeah, good question. So you guys would have to figure out if you define those special groups as visitors. Again, nuance, because you can't have visitors because the perception is that person is a whole other contact tracing human. But if that person was pseudo staff and did all of the training and wore the facial covering and washed her hands, and that's how I would interpret it. That it's not a visitor like a grandma popping in just give us a hug to a kid. It's a professional in the worker lane.
Okay.
Nuanced. And then field trips is tricky. I've been working with the camps too. The day camp people are so interesting. They want to like take a bus to some of these parks that are closed, not sneak in because I think they'd have permission, but empty park. And so it's all very practical. Like you can take a group somewhere, but there has to be a sink and you have to clean the bathroom and you have to, do all the physical distancing and then get them back into the sink and out. So yeah, I think you can go take hikes and go up to parks but just think about your hands, think about their hands, and please know that we'll learn from each other. I mean, does everyone just need their own thing of hand sanitizer on their belt? And you just do that, you go off to the beach, and it's a lot. I don't know what's going to be open. Have you noticed how it's really Fridays when the governor announces new openings, and I think he's going to say something. He did retail, surprised us with Monday was retail. So I don't like the term field trip because it implies this like huge group of people doing something, but little trips within the pod, I think can be managed with the guidance.
Okay. Would you take groups swimming? Would you go to the pool or to beaches?
Today, yeah, because we have this is data driven for me. I feel very safe right now. We do 700 to 800 tests a day and there's 0 positives. Like, are you with me on that? That's like, and the healthcare providers are telling me no one's got a runny nose, so they have no one to test. That's why we shifted to asymptomatic testing, because there's no one sick. It's a whole lesson in hygiene because we're all home and people aren't sick because we're not. So I would go swimming today. Yeah, I think you know your kids best. Are they going to tackle each other, and is it going to be too hard to manage? And what size is your group, and can they come out and dry off with their own towel and then wash their hands? Yeah, I think they can swim.
So I want to shift gears to staff and testing and screening of
Hmm.
staff. Um, you know, do we need to screen all our staff every day when they come in?
Oh yeah.
Okay. Do
So
we,
health screening is staff and kids. Just a nice routine part of the morning. Hi everyone. Make sure you don't have a temp.
should
I
we
thought you
be,
meant testing though.
well, I'm going to get to that. So that was the
Okay.
next question they had was, do our staff need to be tested? Um,
Yeah. So watch me do this tightrope here. Okay. So testing of anyone, healthcare workers, childcare, it's it has some purpose in the epidemiologic understanding of where's this virus and how do we get people home that have the virus and don't know it. But in the context of caregiving, even health caregiving, it's too, you're not going to get tested every day. So getting tested is not a clearance principle for returning to work, going to work, caring for kids or anything. So this thing is completely separate. The testing thing is completely separate from opening up care, opening up summer, and getting folks back in the world. So it should never be linked to employment. It's not required. It's completely offered as a, hey, does anybody want a test kind of thing. And it got a little conflated in the beginning because we wanted childcare workers that, or those of you that have been caring for people during the emergency time to feel like you, because we put you right there with healthcare workers. So we thought if you guys feel like you've had some exposure during the time when there was virus here back in March, go ahead and get tested. But it was more just as a courtesy to you for your great work. It wasn't about employment. But see how many sentences that took? Like it's just in, and healthcare workers is so bizarre. I'll just go off on that. So it makes a lot of sense to test healthcare workers who are going into an elective procedure right now with a human. And that's been opened back up. Outpatient elective procedures are open. So test the nurse, test the doctor, test the anesthesiologist, get all that squared away, test the patient, do the procedure, everybody's negative, right? But to test like a pediatrician, just to be out going back to doing checkups is the same dilemma. So like my pediatrician colleagues, we do a call every day with like 130 child health providers, family medicine, pediatrics. And they say, do you want me to do Mondays? Do you want me to get tested the first Monday of the month? Like, so it's the mixture of like needing more information, but not knowing how to exactly implement it in a practical way. So you guys should just go get a test if it's of interest to you personally, but please don't think it's some clearance principle or like a passport to go to work there.
Thanks. So now I'm thinking about my staff, and I've got two situations. I've got some young staff who have told me that they're not practicing physical distancing in their private life. So what do I do about that? And then I have some older staff that I'm concerned about their health and their age. What do I do about that?
Okay, let's start with the young folks. So this is your lane because I think there are some young people that are, invincible and they're having their experiences, but I don't want to put too much energy on that because the press picks up on that. There are all these articles like the young people congregating, and it's not what any of us believe, right? We know young people are awesome and they're doing the best they can. So if your staff tells you that, I would say you have to stop. Like I'm interested in this principle of our ability to talk to each other about our behavior. This is my, and maybe you guys have personal experience with this. When you're in the grocery store, do you say to the people without masks or cloth facial coverings, like, hey, you need to put one on? And I do it because I can do like a weird shrug. I have this middle child personality and I can say like, hey, I work in public health and we're supposed to all be wearing the thing. I do it in that, because I don't like people to feel attacked. So anyway, with that, I want all those young people to work in your programs this summer, and I want them to cut it out. I want them to heed it's a really strong principle. It's not made up. The respiratory droplet thing and the facial covering and the distancing is real. It's how we got to such a good place here. And then the older folks are tricky. So here's what we said in the guidance. CDC is all fussy. If you're over 65, if you have one of a long list of chronic diseases, or if you're pregnant, it's not advisable to care for children. And we found out very quickly in Vermont that our workforce is, many people are in those categories. So we ask in the guidance folks to talk it over with their healthcare professional. Because none of you want to get into that place of how bad is the asthma, right? Because asthma is a super common illness, disease that some people have just a little touch of, or they have it well controlled, and other people are quite significantly affected by it. And the docs can make those decisions for the patients, right, with them. It's like it needs to be like a team of people together in the health arena saying, what's the risk-benefit analysis? Because I should have said that at the beginning. Everything we do as a society until the vaccine has risk. It has just some risk. And I think people that are 66, they have to ask themselves about their own health, their own medical experience, and whether that risk is small enough to care for kids. It's a super imperfect answer, Holly. I'm sorry. It's just, it's so subjective, and it needs a lot of individual case-by-case stuff.
And I assume that thinking too applies. So there's a question now about children with severe asthma. Like,
I don't, right? I mean, this is kind of my lane with kids with special health needs. There's a group of kids that shouldn't be in care this summer. It's so unlike everything else we believe in terms of exclusion principles, but they're vulnerable and they need to stay home. And I'd like to figure out how to care for them as a society. But I don't, there's these groups and this preventing viral spread. It's all good, but it's not, for that vulnerability, it's too risky.
I also want to bring up into this context, I know many of our programs work under licensing regulations. So this difference between a guidance and regulations. And what do you mean when you're saying it's suggested but not required, or recommended?
Oh, did I send you, Holly? We pulled out, there's 5 things that are must and everything else is should, or those aren't the right words, but there's 5 things that are must. And they're not must because of the childcare regulations. They transcend that. They're the facial coverings because it's the governor's executive order. It's the group size. You can't just decide that you're not going to do that. So I thought I sent them to you. I'll send you the 5 things that are you guys would consider like a regulation, but I've uncoupled it from Child Development Division because I just don't. This is health guidance, right? Public health stays in this. We don't fine people for smoking. We ask them to consider quitting, right? It's funny for me, but it's taken several weeks with child development to pull out that word must and to get it uncoupled from licensure and regulation. But we successfully did it, except for 5 things, which I'll send you. Okay. And they're not things. They're like about the way you do food prep. I mean, those rules transcend us, and it's about couple other things. So I'm sorry, I could pull it up, but I would risk losing the Zoom. So no, I'll do it after.
Okay. We still have 15 minutes with you. I don't want to lose. But for everybody on the call, we will email that out as the follow-up. So make sure you all have that. I will also say there are some of the questions that came through that were very specific. And I know, Brina, that you have the nurses who are on call and the phone number. So I want to make sure that that's something we get to people. So there's questions about, what if they have, they're coughing, but they don't have a fever, or they have a fever, but no other symptoms.
Yeah. So we're working on that a little bit harder today because the pediatricians are pushing back a little bit and saying, kids with runny noses need to be able to participate. And the answer is no. You can't go to programs this summer if you have illness symptoms. And it's this we're being so open and collaborative to get kids into these experiences, but there's no way to sort that out real time. And I don't want to put that on any of you. So the only thing I'll say is if you have a kid with a cough that has coughed for 5 years, because he's got a little asthma and he's well controlled, but he just has a tickle, or he's got seasonal allergies and it's very clear, and then I think that conversation needs to occur, and I think that family has to get a note from their doctor. And I've told my pediatric colleagues, don't be a pain about that, because I don't want to be. So I go like all in that, no respiratory symptoms, and then I say unless these little teeny groups of kids that might have a little seasonal allergy that's diagnosed, not made up, or a chronic cough from having some asthma that's well controlled. And you guys should not be in any position to have to decide any of that. And I hope we can change this someday. You know, in August, maybe we'll say, oh yeah, let's start letting kids in with little stuff. But fever alone, you know, I feel really good about the health screening of the temp, but fever alone is not, the absence of fever is not reassuring enough to let kids with cough in, or runny nose. Big problem, I know.
Yes. And so if I'm running a program, I'm not required to have a nurse if I don't have access to a nurse. But if I
No.
do, that would be great.
Always great, but definitely, you know, we know that's a luxury.
Okay. And then I'm going to get that phone number so that I could call the nurses in your division to work through some scenarios and talk through some of these individual cases.
That's right. So the nurses they're really good at talking through illness, resistance, facilities, you know, half walls and curtains and rooms without doors. And we're just learning and learning and learning with you all. And then they're also really good if you get these dreaded calls, like somebody might be having a test, but the results aren't in yet. You know, like there's a lot of like, do nothing. Like when someone has a test pending, you don't do anything, because it's very unlikely to be positive. And then if it is positive, we know exactly what to do, and the health department will be right with you. There's a whole thing we do, and we have 65 people that just do that thing called contact tracing. So yes, we're any level of question is fine. The nurses and some of them prefer, you know, you can call, but you can also email me. And that's been working these last few days, because then I can sort of manage it better, and not, because when the phone comes through, you're in the middle of stuff, and we do have a voicemail box. But because I'll take your emails and put them out to Nate and Sharon Lee. And we actually have a workforce of 4 nurses, but in this interim, we had a little dip with the volume of calls got low. And so we pulled 2 off, but we have 2 to add back. So
Great.
4 nurses, yeah.
Great. What about social emotional learning? Like we focus, or emotional health, like we focus so much on the physical health because this is scary. What are your thoughts on emotional, mental well-being for both staff and for children and youth?
Well, so a whole great frame this morning came in my inbox from Vermont After School. You know, resilience. This is we have you know, I'm making fun of myself, but we have 1-pagers in the beginning. We were so worried about kids, and we should still be worried. But the flip I want to make with all of you already made, which is getting these kids back into some semblance of something that is engaging is going to be, and the sunshine and the physical activity and the laughter and the trying to figure out how to stay 6 feet apart and putting on the silly facial coverings and knowing it's ridiculous and wishing it wasn't so. That's the base that the kids are all going to come back into their space, which is why that video mattered so much to me, because you could see it. There was so much joy in those kids. I think you can work your magic with acknowledging that, whew, this is quite a stretch we're in as a group of people. What's it like to be you? This is where Youth Voice, you guys taught me all this. Like, I shouldn't tell kids what they're experiencing. Some of them might be doing just fine, you know. I have 3 young adults, and some of them are doing better than others, and every day is different. But I think there are some really bright spots to this. People feel more connected to some of their family, and in some ways there may be less electronics, less stress. I doubt there's less video games. But so that's my short answer. I mean, I really rely on you to to find the strengths here. And we went through the Strengthening Families, which for you guys is Youth Thrive. You know, those 5 protective factors, like I like to just maybe just have them on a little card in your pocket and just ask, like, how are we doing today on basic needs, social connection, these kids feeling like they have a understanding of their development? Do they have those opportunities for resilience? I think by design, you're doing it. It's perfect to me. I'm so excited for kids to be back. Even if in October we have little outbreaks again and we have to close some stuff, I'm just going to be glad we got out there again.
I agree. And I want to also to talk about like the stress of that. So let's say we do everything. I'm running my program. I do everything. I got my pods, I got my cleaning, I got my supplies, I'm on it. And then someone gets sick.
Yeah.
What is that my fault?
No.
What am I liable? Are parents going to be after
Never.
me? What happens? Like,
no.
what happens?
So, I mean, did you hear the governor's press conference today? This is just a sidebar, but he told the most poignant, horrifying story about a family with New York license plates that they've lived here for several weeks. It had nothing to do with, not following rules about out of state and quarantining. And somebody yelled just terrible things to this family. So there is no blame in this virus, and there is no attribution. There will be no way to say this came from your program or a doorknob at your facility, because it's at the person's home, or it's at the, I always say grocery store and people tell me not to. So it's at the mobile station, don't name it's never going to be attributed to you. It's going to be like, oh, somebody picked it up. Because you pick stuff, this virus is, well, right now it's nowhere, but in the time in March and April when it was community spread, we couldn't trace it. The only time it was traceable is in the beginning, like the guy from it, there were a few known exposures in other countries that moved here or traveled here. And so that being said, I understand the emotional impact. I will tell you, we still have a lot of communicating to do with each other and our families and the parents about all of this. And I'm doing my very best to get the word out, because there's a whole, I guess what I'm noticing is there's a equity problem here, whereas some folks that have other opportunities for their kids think it's too soon or unconscionable or something. And then to me, we're getting into a funny space about not really understanding the emotional lives of kids and how much they need this. So it's sort of a privileged group of people thinking, yeah, you shouldn't do this till the fall, or without even looking at the data. So anyway, that all being said, you're not without potential people are going to, come at you, but there is no liability. There's no attribution. So you're going to have to potentially have a lot more support from us and each other, and maybe a little thicker skin, because I've had this personal experience. People have called me and said, this is unconscionable. I mean, like, what? That's the strongest word anyone's ever used with me in the context of public health. And it isn't unconscionable. It's the right thing to do. And I'll tell you that the pediatricians are fully behind this. And so, so are your leaders, and people that care about kids know how important this is. So that was too long an answer. I'm so sorry.
No,
Just passion. I feel passionate about this.
I do too. I have one more question that I need to pick up. And then I do want to mention to everybody on the call that on Fridays at 1:30, we're doing Self-Care Fridays. So that is open to anyone, and that is about taking care of yourself and helping to take care of your staff. That will be an interactive Zoom call. Also on Tuesdays, every afternoon is a summer problem solving and planning session that is also interactive, and that is about sharing strategies and working in small groups and talking through all of this as we work through it. So please think about those 2 options, and then Brina will be back again next Wednesday to have another one of these sessions around the health and safety guidance. But the one question that I know has come up a number of times, Brina, before I go into some other resources, is I'm going back to the pods again. So we got our pods, and we got our pods of 25 or fewer, and then I'm the director. Can I go from pod to pod? Or can, or
Good
do I
question. We
really?
get asked that question a lot. I think you could go from pod to pod and wave from far away. I wouldn't care directly for kids. I wouldn't go in and pick up the markers and go and see if you can help draw something. You just have to stay kind of, it's a bummer. So maybe it is going to be that, directors take a pod rather than be in, I'm not sure. You can't really do that close contact just for the rules, just to keep it pure. There's going to be a lot of wiggle,
Yeah.
but in terms of my stating it, I think I need to stay with what I just said. I will ask you, I authentically want your emails, but first I want you to read the guidance because, first of all, I want to see how interpretable it is, because we've worked really hard on it and it's detailed. So if you read through and your question still emerges, that's when I really want to hear from you. And I just asked for confirmation that when the link is live, I promise it'll get right to you.
I think they found it and already posted it in the chat.
Okay, hold on though, because there's been a link all along.
Oh.
So this is I'm so glad you said that. We've had a link about health guidance forever, but it could be new. If it says the date of May 13th, then it's the right one because there's been guidance since April. The old one would say April 5th.
It says,
yay! Oh, look at that. Okay. Except Nate Waite's telling me it's not posted yet.
Oh.
Okay. It says, but it has a draft watermark. Oh, dear. Okay. I will get to the bottom of that the minute I hang up with you and tell Holly. So don't print anything out yet.
Okay.
I'm going to write a book about draft, like version control too. Oof.
Nicole.
Holly, when I send out an email, once we have that link from Brina, along with some of the other things folks asked for in this call, I'll send that all out in one email to everyone that's here.
Okay, perfect. So I want to reiterate Brina's request to read through the guidance. Let her know what your questions are. Let us know what your questions are. Show up Friday for the Self-Care Friday. Show up on Tuesday to dig into the guidance with us and to really to try to figure out what it means. I know Brina's like, everybody email me. I also want to protect her a bit. So that
I'm so glad to see Nate's on because all I'll do is forward it to Nate and Sharon Lee. I'm good.
All right. Well, I want to protect them too. So the more that we can puzzle together and then send sort of united stuff through.
No, that's true. Actually, that might be I am very available, but these few weeks are pretty important to get me out talking to every human. So we have sort of unified advice. So I am going to meet with the other day camp folks and back with childcare and we're starting to talk to schools too. So here we go. Strap on. Yeah.
And that is, we have a lot of conversations as a field we're going to have. We're going to have to talk with our school partners about how to use their building. We're going to have to talk with parks about how to use those spaces. We are going to have to figure out supplies. So we do have some avenues to look at supplies. So please let us know what your supply needs are so that we can get that going, that conversation going. There is also going to be a funding opportunity announced, I believe, on Friday from the Department for Children and Families, which will be money to any program serving children and youth. I believe it's up till 8th grade, but let's see what it says on Friday. As long as you open prior to June 30th. So this would be a check coming to your program. There was $6 million announced by the governor last Friday. That is for early childhood and summer programs that will serve children and youth, opening before June 30th. And it's going to be a pretty quick turnaround. So watch for that on Friday and we'll get that information out. One other thing, I don't know if I already said it, but if you're not on our email list, please get on our email list because we are also partnering with other states around the nation to develop activities and curriculum materials for you. So coming out in early June will be the first 36 activities plus 6 challenges. These are things that you can do with children that be grouped by topic and age. They can be done in person in camps. They can also be done virtually. It's not a curriculum, it's activities and challenges. And it's a way to try to, we recognize that you are going to be focusing on a lot of health and safety. And so some of it might be helpful to have some of these other activities and stuff. So we're partnering with Georgia and I think 10 other states to get that out to you. So make sure, and those will roll out throughout the summer. So there'll always be fresh activities and program ideas, and they're all geared around after school and summer. So if you want to be on those batches, be sure we have your email. And as you move through this and as you discover solutions and clever adaptations, because I know that you will, please let us know what those are so that we can help share those as well. So share your stories, show up on those calls.
Awesome. Guys, I'm going to pop off to the next event.
Brina,
There's been a
thank
ton
you.
of email chatter that it did go live, but that draft watermark has to come off. So if you want a perfect version without the draft, we're fixing it right now. So thanks, you guys
Thank
were
you.
real time helping.
Everybody wave to Brina.
Thank
please.
you.
Thank
Oh,
you.
everybody wave. I'm so grateful for all you're doing. Keep in touch.
We really
Bye.
thank you, Brina. All right, everyone, we are at 3:03. So thank you so much for chiming in. We will do this call again a week later. So who knows what will have changed between now and then. But if you want to come back for more on this, we will have Brina back next Wednesday. And then, like I said, there is also Friday and Tuesday. Tuesday in particular, if you want to dig into this and problem solve and talk about some of the specifics, that's a really good call to be on. Friday really is about self-care and sort of ending the week thinking about yourself and what you need, and how do we do that and make sure that we're always building in that space. So watch for the resources to come, and thank you so much for all that you do, and thank you for being such strong partners in this. Take care, be safe, and we'll see you on the next one.